Professor Teo Yik Ying is here to weigh in. He's the Dean of NUS's Swee Hock School of Public Health. Welcome to the show, Professor. Professor, first up, what do you make of the countries that Singapore has chosen to open up to, given their differing ways of managing COVID-19?
Thank you for having me. So I think we can see very clearly that there are essentially three broad considerations in determining which countries that Singapore will open up to with the VTLs. I think the first is clearly the present COVID situation in these countries, and I think that is directly linked to their vaccination rates as well. And in most of these countries, actually, they have fully vaccinated more than 60% of their population. So I think that's one of the key determinants. The second is actually not on the public health side, but more on the economic side, because I believe these are countries where there are strong economic ties, especially in relation to Singapore's economy and our status as an air hub in Asia Pacific. And the third reason, I believe, is that it's linked to the number of residents living in these countries that need to travel to and back to see their family. And this includes Singaporeans that are currently based in these countries for either for work or for studies. But ultimately, I believe the aim is to open up Singapore safely with minimum impact to the health of the people in Singapore, while balancing some of the very real economic realities that we are facing.
Professor, VTL travellers will soon only be subject to 2 PCR tests instead of 4. What are the risks in cutting down the number of tests?
So certainly by cutting down on the number of tests, the worry is, will we see more infections slipping through? But actually, by and large, I do see this as linked to the overall strategy that Singapore is adopting, and not just view it from the isolation of a travel lane testing policy. We have seen that nationally, we are actually simplifying the testing protocols in Singapore itself, even for people with COVID-19. And in the endemic stage, we will certainly expect there will be community infections happening. So the testing protocols for these VTL travelers with 2 PCR tests is actually, in fact, much more stringent than the simplified protocols that we will have in Singapore for COVID-19 cases and for suspected cases. So the change is in line with the overall strategy that we will adopt. There will be a few cases that will slip through, just like how right now we see a couple of thousands of cases in Singapore in a day. But I think I should mention also that there are many countries right now that are already moving away from even having such pre- and post-flight PCR tests. Some require simply ART testing. Some doesn't even require any testing at all now.
Most of the VTL countries are open to travellers from Singapore. Now, my friends are very excited upon reading the news. But Professor, what's your advice for people like my friends who are excited to travel, given that also the colder months are approaching?
So I suspect with today's announcement, there will be people who have the opportunity to travel. They will be cheering the announcements. I suspect, especially with respect to South Korea and some of the more popular winter destinations in Europe, given right now there's this popularity over Squid Game and many things regarding to K-pop and things from Korea. But I think just before you rush to book your air tickets, make sure you understand what are the local requirements in the country you intend to visit. Because actually, despite the fact that we have a vaccinated travel lane that smooths out all the frictions for us to travel over and travel back, but once you're in a foreign country, you will still have to comply with their requirements, whether it is in terms of vaccination checks. In Singapore, we have Trace Together. You could very simply check your vaccination status. If you're traveling to one of these countries, you need to understand how will your vaccination status be checked. What are the safe management measures that they have in the country? And also, very importantly, if you're making any travel, consider travel insurance with full COVID-19 coverage. Some countries actually require that. So do some reading up on the healthcare system of the country you intend to visit, because, touch wood, I suppose, you or your traveling companion could come down with COVID while overseas, and you want to know, if that does happen, what can I do? And finally, the year-end season is typically the influenza, the flu season for many of the countries that we look at for the VTLs. So if you intend to take advantage of the travel lanes, please do consider getting an additional vaccination. This time is the flu jab before you travel. So other than the above advice that may seem to be slightly a party pooper, today's announcement is certainly something to cheer about ever since we closed our borders during the school holidays in March last year.
Professor, let's talk about the domestic situation now. Tighter curbs were announced for unvaccinated people who will be banned from malls and attractions. Why do you think this is necessary, given these places are primarily mask-on situations?
Well, I think this was always inevitable because we have two choices. The first choice is, at some point in time, Singapore have a vaccine mandate to say that everyone must go for your vaccination. And for that to happen, we first need for the vaccines to be fully approved rather than what currently we have, the PISA approval, which is the special access approval because of the pandemic. That's one thing that we can do, a vaccine mandate. Or secondly, before we reach that vaccine mandate, we need to sharply regulate what the unvaccinated people can do or cannot do. And I emphasize that actually this differentiation is not meant to be discriminatory. I suspect those who are unvaccinated now would be very unhappy to say that why am I taken, my rights to even go to the mall or to dine in is taken away from me. But I think you have to view it from the perspective of the policymakers. Many of the people who are fighting for their lives now in the ICU, who requires a lot of healthcare attention, are the ones that are unvaccinated. And if you are a responsible policymaker, do you leave it to individuals to exercise their due diligence that if I'm not vaccinated, I don't move around, or I should go and get my vaccination? Especially when you know for a fact that the rest of the country will be opening up, people will be moving about, people will get infected, the risk to the unvaccinated people will increase tremendously. So I think those are very hard decisions, but a responsible policymakers will need to make some of these choices where necessary, essentially to protect the lives of the people.
Professor, that said, more unvaccinated people, however, now will be allowed to recover at home. Let's talk about risk there. Are there any risks?
So if we look at who are the people that are eligible for that, this is currently still only for people who are younger, and I define young as those 50 and below. And the data that we have so far clearly shows that the risk of disease and death to people in this group, if they are unvaccinated, is low. And I will use the migrant workers as an example, because we saw last year where there were more than 100,000 migrant workers infected. Most of them were young and healthy and below the age of 50. Many of them didn't actually need to go to the hospital for medical care, for medical attention. Now, of course, I should emphasize that the Delta variant that we have circulating now is different from what was circulating last year. But the overall evidence that we have so far, locally, internationally, actually hasn't changed. It consistently shows that younger people have a lower risk. And I think we always have to ask the question of opportunity cost as well. Even though when we hospitalize young people who are unvaccinated out of caution, the opportunity cost would be we are depriving someone else, perhaps with greater medical needs, whether it is related to COVID or not related to COVID, of that medical attention. So on the whole, I would say that this is a balanced decision. I expect the risk of home recovery to be very low. It's not zero risk, but very low risk. And actually, to make it even lower, for the risk to be even lower, any of you 50 years and below eligible for vaccination, please do go for your vaccination. Please do go for your booster jab when it's offered to you. Right now, we know if you're 30 years and above, it's offered to you.
Earlier, Prime Minister Lee as well addressed the nation. Our PM Lee spoke emphatically about Singaporeans needing to update our mindset in order to live with COVID-19. Let's have a quick listen.
We should respect COVID-19, but we must not be paralyzed by fear. Let us go about our daily activities as normally as possible, taking necessary precautions and complying with SMMs. With vaccinations, COVID has become a treatable, mild disease for most of us. So for 98% of us, if we catch COVID-19, we can recover by ourselves at home just as we would if we had the flu.
Professor, does it mark any change from the mindset we've had before? And just to round up our discussion for today, how would this message influence our COVID-19 measures moving forward?
I think certainly it marks a significant change in the mindset that we have had. Because for quite a while now, I think in Singapore, we have focused a lot on striking fear into the population, because for the past 18, 20 months, Singapore, we have done very well because we've communicated very clearly what are the risks of COVID-19 to the people. If you're infected, you may pass it on to your family, you may pass it on to your colleagues at work. So we've done very well communicating that message. So our population actually have an understanding of COVID right now that predates the arrival of the vaccine, that we have to be very careful, we have to manage our own risk, try not to get infected. But right now, we have vaccines, and the vaccines, the data is very clear. They are very effective at preventing disease and death. There are some people that will suffer from some of the harsher realities of a COVID infection despite being vaccinated. But the risk of this group, we know who these people are, and we offer the right medical attention to this group. But for the vast majority now, because we have been fully vaccinated, actually the risk is now very low. I highlight the difference. Why now we are changing this mindset? We're talking about changing mindset, that we are saying that you don't have to be worried about COVID-19 anymore. We have changed the message completely, that it is nothing to be feared now. And the reason is because we have the vaccines, and the vaccines are very effective at preventing disease, at preventing deaths. And I would like to highlight some numbers, because I think in the past 28 days, people have been distracted by there are 9 deaths happening, there are 3 deaths happening. We had more than 45,000 cases in the past 28 days. More than 44,000 of these cases have fully recovered or are in the process of fully recovering with no long-term health impact. And I expect out of this remaining 1,000 or so, many of them will go on to recover as well. Now, our headline reporting of COVID-19 will have to change. And this is a mindset that has to be changed, not just of the people, but maybe of the media outlets, maybe amongst the policymakers. We need to change the headlines reporting, because right now we tell people every day, we have 3 deaths, we have 9 deaths from COVID-19. But we never tell people that we have 16 deaths on average in a day, one day, 16 deaths from cancers alone. PM today mentioned we have about 4,000 deaths in a year from pneumonia. That translates to about 12 deaths in a single day from pneumonia. We never reported it this way, but for COVID-19, if we continue to report deaths the way that we're doing right now, I think people will constantly have that fear. So moving forward, I think COVID deaths will still be there, and it will happen. And this will happen to people of much older age, especially if they have underlying medical conditions. I think PM has addressed this very directly now. We have also talked about that greater differentiation between vaccinated and unvaccinated people. That is likely to stay. And we have seen worldwide, in France, you can't go onto public transportation if you're unvaccinated. So this is going to feature quite significantly in many countries worldwide, not just in Singapore. But I think one key mindset change that now has to happen as well is that we will move on, and personal responsibility is actually going to be very important. That we need to know when we need to go to the hospitals, or actually when we just need to go to the polyclinics, to the GP, or even just recover at home. Some of this we will have to learn along the way. I think this is the only way we can truly live with COVID-19 for the long term.
Thank you so much for your perspectives and of course for your time today on a Saturday afternoon. As always, I'm happy to be joined by Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS.